These diseases include heart disease, cancer, stroke, diabetes, and arthritis, among many others. 7 out of 10 deaths in Americans occur from these diseases each year. In 2005 alone, 133 million Americans, that's 1 out of every 2, had one of these type of diseases. What type of diseases could these be, you ask? These types, as described by the Centers for Disease Control, are chronic diseases. I learned a lot about chronic diseases in my studies of health services at the University of Evansville, but I did a lot more research on the topic so I can give you this information today. Today I would like to inform you about what chronic diseases are, what their prevalence in the United States is, and also how they can be prevented. The first information about chronic diseases I would like to inform you about today is exactly what they are. Chronic diseases are illnesses lasting for an extended period of time. The U.S. National Convention for Health Statistics says that these are illnesses lasting 3 months or more, and they include things like cancer, arthritis, obesity, and stroke. They are long-lasting and they are quite expensive. They're expensive users of time and money, and they're the #1 driver of healthcare costs in the United States. The reason they're so expensive is because after detection, constant maintenance of the disease must occur. You may have to visit the doctor on a regular basis, whether it be weekly, monthly, or more than once a year. You have to take many medications. You have to do constant ongoing treatments and checks, including dialysis if you have kidney problems, blood sugar checks if you have things like diabetes, or blood pressure monitoring if you have high blood pressure. These diseases cannot be prevented by vaccines, and they usually don't just go away on their own. And since they can't just disappear, there's got to be a lot of money spent on the constant maintenance and upkeep. There are many damaging healthcare behaviors that cause these type of diseases. They include tobacco use, lack of physical exercise, poor eating habits, and many others. Usually one of these chronic diseases is coupled with another, so if you have one, you usually have another one to go along with it. So now you know a little bit about these diseases, let me explain to you what their prevalence in the United States is. As I mentioned earlier, 7 out of 10 deaths a year occur due to chronic diseases. According to the CDC, heart disease, cancer, and stroke account for 50% of the deaths each year in the U.S., and these are among some of the top causes on the list of deaths. The medical dictionary describes that 88% of Americans 65 and older have one of these diseases. And the CDC adds that 25% of Americans living with these chronic diseases often have at least one activity of daily have an activity limitation on a daily activity. For example, if you have arthritis, you may not be able to walk around everywhere, get to the places you like to go to. 19 million Americans report having problems due to arthritis. Diabetes is also another cause of limitation. It's a leading cause of kidney failure, non-traumatic lower extremity amputations, and blindness in adults ages 20 to 74. That's a huge age span for that disease to be affecting. So after you're seeing how prevalent these diseases are in the U.S., you must be asking yourself, can these be prevented? And it turns out there are many ways to do so. There's an article written by Jeanne Grunert that was basically titled on how you can prevent these diseases, and there's 4 main ways to do so. I created a poster here to highlight some of the ways that they can be help to be prevented. The first thing you can do is, and all these have to do with following a healthy lifestyle, but the first thing you can do is exercise. It's good to exercise at least 3.5 hours per week, and doing so on a daily basis would even be better. It's also good to eat healthy and exhibit good eating habits, having a diet high in fruits and vegetables and low in meat, especially red fatty meat. So in the center here, I showed a picture of the new My Pyramid, which is another food guide pyramid. For years and years, the old food guide pyramid was in the shape of a triangle and had at the base the amount of servings of food you're supposed to have the most of, and at the top it had the smallest part of the triangle that you're supposed to eat the least of. And that was, everybody was supposed to have the same servings. It was a broad pyramid. No matter if you were 5 or 55, you could eat the same servings. So now it's become more related to the person. So you can go into myfoodpyramid.gov on the internet, which is it's an internet site on the internet, and you can print out one of these pyramids. And how you get your result on the pyramid that's right for you is you put in information such as your age, your height, weight, how much activity you have each day, the types of foods you eat, and then it spits this pyramid out. And the bigger the piece of the triangle is, the more of that amount of food you're supposed to have for the day, and the smallest piece is the least amount of the type of food you're supposed to have for the day. And this can help you to eat healthy and maintain a good weight. Another way you can avoid these chronic diseases is by not smoking. The CDC says that 43 million Americans smoke, and this can cause cancers of the throat, lungs, mouth. It can cause emphysema, heart disease, stroke, and many other chronic illnesses. Also, quitting can help. Just because you smoke now doesn't mean you can't also quit now and help you to halt these chronic diseases or prevent them from occurring. Another thing to do is to maintain a healthy body weight. Obesity is a big problem in the U.S. due to our bad eating habits. The CDC says 1 in 3 adults is obese and 1 in 5 youth ages 6 to 19 are obese. Obesity can cause diabetes among many other illnesses. So maintaining a healthy weight can also help to promote you to exercise or continue exercise and to keep eating healthy so you maintain that healthy weight. So as can be seen from the previous information on chronic diseases, they are long-lasting conditions in the U.S. that are highly prevalent but can be prevented if a healthy lifestyle is maintained. So the key that I would like for you to emphasize from this speech in conclusion is that prevention is the main concept to take away. We're young now and we have the chance to prevent these diseases in the future by exhibiting healthy habits now. We can not smoke, we can eat healthy, we can keep our alcohol consumption to a minimum. All these things can help us. Dr. Kenneth Thorpe was a professor and chair of health policy and management at Rollins School of Public Health at Emory University. He said prevention is not just disease detection. What I think is what should be the take-home message here is that there are many things we can do to prevent these diseases before we find out we have one of them detected in us. We don't just want to detect them and then start taking care of it. We want to be able to take care of ourselves so that we never have to detect one of these diseases, that we never have one of them. So prevention is the key. If prevention occurs, and all the other items discussed previously in this speech will be irrelevant and they'll not affect us. We don't want to become one of those 133 million Americans in the U.S. with these costly diseases for the rest of our lives.